Hi, my name is Zella Jewett. My student ID number is 3433742, and this is for the first video for my Clinical Pathology 1 course. So today we're going to be going over a little bit of care and maintenance of a refractometer. So a refractometer is a device that measures the refractive index of a substance, and it's most commonly used to measure the specific gravity or the protein concentrations in a liquid such as urine or plasma. So it should be cleaned after each use and calibrated weekly. When you're looking in at least this particular model, you're going to see a couple of scales that run up and down, and the top section is going to be dark and the bottom section is going to be light, and where those two sections meet up is called the light-dark interface. And by lining the light-dark interface up with the scale is how you're going to get your reading. So for calibrating it, if you lift up this little black thing right here, you'll see a little screw in there, and you're gonna take this little screwdriver and twist the screw, and that's how you're going to calibrate it. And you're going to calibrate it using some distilled water, because distilled water should always have a specific gravity of 1. So I'm going to lift the cover plate up, and I have some distilled water in this pipette. I'm going to put a drop or two on there, and that's just on top of the prism glass cover. Then I'm going to put the cover plate down, and I'm going to look at this in an area where there's bright light and see if the specific gravity is 1 or not. So it looks like the specific gravity is 1, so that means that it's properly calibrated. Again, if not, I would just look at it and take the little screw and adjust the screw until it hits 1 on the specific gravity scale. Now to clean it, I'm going to lift the cover plate up, and then I'm going to use a piece of lens paper to make sure that there's not going to be any scratches on it. And I'm going to wipe everything completely dry. And if there's any smudges or debris that I'm not able to get off on this, like if I was measuring some urine or some plasma, then I would use some saline to get everything off. But other devices may require different substances to use, like some might require alcohol, but this one uses saline. So now that it's all nice and clean, I'm going to put the cover plate back down and put this back on the little adjustment screw, and now it's ready for its next use. So today we're going to be doing a blood draw on a dog, and we're going to be drawing blood from the cephalic vein. So before you start, you want to make sure you have everything prepped and ready to go. So we shaved the area that we're going to be drawing blood from, and we also have alcohol to clean the area and the needle that we're going to be using. And you want to do a needle that is about close to the size of the blood sample that you want. So I don't need a lot today, so I have a 1 ml syringe with a 25 gauge needle. So first of all, we're going to clean the area, make sure the blood is, the fur is wiped down. And then you're going to have one hand on the leg with the thumb to help stabilize the vein. And then you can have the other hand to help you palpate it. And my holder is holding off on the vein as well. Just gonna put a little bit more alcohol on there. And we're gonna take our needle and syringe, and we wanna make sure that the bevel is facing up. We're gonna insert the needle and gently pull back until you get the right amount that you need. Okay, release. And now I'm just going to apply some pressure to the area that I pulled the needle from. Okay. And now it's ready to go to the lab. So today we're going to be making, staining, and reviewing a blood film. So a blood film is used to determine the differential white blood cell counts, to estimate platelet numbers, and to examine the morphology of white blood cells, red blood cells, and platelets. So there's 2 techniques that you can use. One of them is a cover slip technique, and that's great for small sample amounts. But the technique that we're going to use today is a wedge smear technique. So that utilizes 2 slides and a transfer pipette. So you want to get your sample, which I already have, and I made sure that I inverted it a couple times to make sure it's well mixed. So I'm going to take my pipette And I'm going to draw up a small amount. And then I'm going to put it towards the end of my slide. And then I'm going to use the other side as my spreading slide. And so I'm going to put it on the edge at approximately a 30-degree angle. I'm going to slowly back it up into my blood droplet, wait until it goes all the way across my slide, and then in a smooth, quick, easy motion, I'm going to slide it back. And so when you're doing a slide, you want to make sure that you have a nice feathered edge on it. And then all we have to do is, after we get a smear that we like, is wait for it to dry, and then we'll come back and stain it. So now that our slide is dry, we are going to go ahead and stain it. So we're going to take the lid off of this first stain, and then we're going to put it in our stain. Okay, so that's going to stay in there for about 1 minute, and that's going to be our fixative. So that's going to contain about 95% methanol, and that's what's going to fix the blood cells to the slide. And then after it's going to be in this one for a minute, we're going to move it to our eosin stain, and that is a buffer to an acidic pH, and that's going to stain the basic components of the cell, such as the hemoglobin and the eosinic granules. And then after it's in this one for 30 seconds, we're going to put it into this darker blue one right here. This one is our methylene blue, and it is buffered to a basic or alkaline pH, and it's going to stain the more acidic components of the cell, such as the leukocyte nuclei. So we're going to open this one up. And then I'm going to use tweezers to take the stains, or take the slide out of the stain, so that way I don't get anything on my fingers. Okay, so I'm going to take this one out, and then I'm just going to dab it on the paper towel, and I'm going to put it in the eosin solution for 30 seconds. I'm going to close this one up. And I'm going to open the methylene blue. Okay, so a few more seconds left on it. Okay. So then I'm going to take it out of the eosin, dab it on a paper towel down there, and put it in the methylene blue solution. And again, that's going to be in there for 30 seconds. And then I'm going to want to get some distilled water, so that way I can rinse my slide off after it's properly stained. Okay, so we only have a few more seconds left on this one. I can take it out of my methylene blue, dab it on the paper towel, and then I'm going to gently rinse it off with distilled water on both sides. And that's just to rinse the excess stain off. Okay, so now that it's been rinsed off, I'm going to let it dry right there, and then we will come back to it, and as soon as it's dry, and we'll be able to look at it in the microscope. Okay, so now that we have a blood film that has been stained and is dry, we're going to look at it underneath the microscope. So we're going to look under it with the 100 times magnification, and what we're looking for is just a general estimate of the cell numbers, and we're also going to look for any abnormalities such as large abnormal cells or platelet clumps or any microfilaria in there. So I'm going to turn it on. Spot where I can focus it, and then I'm going to scan the whole entire slide. So now that we've looked at the whole entire slide, we are now going to perform the differential cell count on our white blood cells. So to do that, you're going to want to locate the feathered edge, and that's going to be the area where the cells are going to be erratically distributed and they're going to be greatly distorted. So you want to look at the area just adjacent to that in the monolayer, and that's going to be where the blood cells are more evenly distributed and they won't be as distorted. So I went ahead and did that on the next highest power, and then we're going to look at it in our oil immersion. So I'm going to get it, and I'm going to put a drop of oil where it had a focus, and then I'm going to put this into focus. Okay. And then what I'm looking for in there is the different types of white blood cells. So I'm going to count a minimum of 100 white blood cells, and I'm going to record the different types as I count them. And then after I've counted 100 of them, then I can determine the relative percentage of them. So say I counted about 65 neutrophils out of my 100 blood cells, my relative percentage is going to be 65% because 65 of the 100 blood cells were neutrophils. And then by finding the relative percentage, you can also determine the absolute value of your blood cells as well, to determine if the patient has an excess amount of a certain type of blood cell or not enough amount of a certain type of blood cell. And that's how you review a blood film. Okay, so today we're going to be doing a PCV and a total solids test. So a PCV stands for packed cell volume, and it's the percentage of whole blood that is red blood cells. So to do that, I have my blood sample right here. And I have a microhematocrit tube. This one is heparinized. You can tell by the little red band on the top. There are some that are plain and they will have a blue band on it. So what I'm going to do is I'm going to fill it up about 3/4 of the way full. And then I'm going to pack the bottom of it with clay, and that's just to make sure that my sample doesn't come out. Okay. And then I have a second one that I'm going to do, because you always want to do 2 of them. And then again, I'm just going to fill it about 3/4 of the way full. I'm going to pack this one with clay as well. Okay, I'll put the lid back on my blood sample. And then I'm going to put them in my centrifuge. And you want to make sure that the the clay is facing to the outside, and the open end where the blood can come out is facing to the inside. And then I'm going to put this on. Okay, and I'm going to close it down. And then I want to make sure that it's set to the microhematocrit setting, which it is. So that button is set to it, and our dial is set to it. And now we're just going to wait for the centrifuge to stop spinning, and then we'll come back to it and finish our PCV. Okay, so now that our centrifuge has stopped spinning, I went ahead and took the microhematocrit tubes out. So because the red blood cells have the highest specific gravity, they're all going to go down towards the bottom. So it's going to be this red color layer right here. And then just above it, there should be a whitish grayish color, and that's called the buffy coat, and that's going to have the white blood cells and platelets in it. And then the layer right above it is going to be the plasma layer. So to read one of these, you're going to line it up, so that way the bottom of the red blood cell layer is at the 0 line, and the top of the plasma layer is at the 100 line. And then wherever the red blood cell layer ends, at the top right here is going to be your PCV number. So it looks like this one is at about a 28, so my PCV would be a 28. And then with any PCV, you're going to want to do a total solids test, and that measures the amount of protein that's going to be in the plasma. So first of all, you want to take note of the color of the plasma. A normal color should be clear or a pale straw yellow color, but if it's cloudy or reddish tinge to it, then the cloudiness could be that it's lipemic, or the reddish tinge could be that it's hemolyzed. So we're going to take a refractometer, and we're going to break the microhematocrit tube just above the buffy coat, so that way you're going to have one section that's just plasma. And then we're going to take it and put our plasma on the prism glass cover, and we want to make sure that we don't tap the microhematocrit tube on the cover, because then it could damage it. So we're going to put the cover plate on, and then we're going to look at it in a bright area of light and see what our reading is. So I'm looking where the light dark interface is, and it looks like this one is at 5.9, and that's going to be grams per deciliter. So my result is going to be 5.9 grams per deciliter.